Hello, beautiful ladies, and welcome back to Vital Her. I'm so glad you're here with me today. For those of you who are new to our community, welcome aboard. You're in exactly the right place to take control of your intimate health. My name is Dr. Mary Williams, and I'm a board-certified gynecologist who has been practicing women's health for over 15 years here in the United States. I've dedicated my career to helping women understand their bodies better and feel confident about their health decisions. Today, I need to have an honest, important conversation with you about something I see far too often in my practice. Just last week, I had 3 different patients come into my office with preventable intimate infections. And the cause? A simple habit they didn't even realize was putting them at risk. Before we dive deep into this topic, I want to ask you for a small favor that means the world to me. If this information helps you today, please take a moment to subscribe to Vital Her, hit that notification bell, and share this video with the women in your life. Your support allows me to keep creating this content focused on women's intimate health, content that I believe every woman deserves to know. In the next few minutes, we're going to explore 2 crucial areas. First, I'll reveal this common post-sex habit that's causing infections, and then I'll give you practical steps to protect yourself and maintain optimal intimate health. Ladies, let me start with a scenario that might sound familiar. Sarah, a 28-year-old teacher from Denver, came to see me last month feeling frustrated and embarrassed. She'd been dealing with recurring urinary tract infections for 6 months, and despite following what she thought was good hygiene, the infections kept coming back. During our consultation, when I asked about her post-intimacy routine, she mentioned something that made everything click into place. The habit I'm talking about today is one that affects millions of American women, yet most don't realize the connection between this behavior and their recurring infections. I'm talking about not urinating immediately after sexual intercourse. Now, I know what some of you might be thinking. Dr. Williams, that sounds too simple to be true. But hear me out, because the science behind this is both fascinating and crucial for your health. During sexual activity, bacteria from the anal area and external genital region can easily be pushed toward and into the urethra. That's the tube that carries urine from your bladder. In women, our urethra is significantly shorter than in men, only about 4 centimeters long compared to about 20 centimeters in men. This shorter distance means bacteria have a much easier pathway to reach our bladder and cause infection. Here's where the post-sex urination becomes your superpower. When you urinate within 30 minutes after intercourse, you're essentially creating a natural flushing system. The flow of urine helps wash out any bacteria that may have been introduced during intimacy, significantly reducing your risk of developing a urinary tract infection. But here's what concerns me most in my practice. I see so many women who either don't know about this simple preventive measure, or they've heard conflicting information that's left them confused. Just 2 weeks ago, Jennifer, a 35-year-old marketing executive from Phoenix, told me she'd been avoiding urination after sex because someone told her it would affect her chances of conception. Ladies, this is completely false and potentially harmful misinformation. Let me share some eye-opening statistics with you. According to the American Urological Association, urinary tract infections affect more than half of all women at least once in their lifetime. In the United States alone, we see approximately 10 million UTI-related doctor visits each year, with the majority being women of reproductive age. What's even more concerning is that about 20 to 30% of women who get one UTI will experience recurrent infections. The financial impact is staggering too. Americans spend over $2 billion annually on UTI-related healthcare costs. But here's the empowering part. A significant portion of these infections could be prevented with simple post-intimacy hygiene practices. Now let me address another common mistake I see in my practice. Many women think that because they shower regularly and maintain good general hygiene, they're automatically protected. While overall cleanliness is important, it's the specific timing and actions after intimacy that make the crucial difference. I had a patient, Maria, a 31-year-old nurse from Miami, who was meticulous about her hygiene routine. She would shower immediately after sex, use feminine washes, and follow what she believed were best practices. Yet she was still getting UTIs every few months. The missing piece? She wasn't urinating before her elaborate cleaning routine, which meant bacteria had time to travel up her urethra while she was focused on external cleaning. Here's another critical point that many women overlook. The type of sexual activity matters. Any form of penetration, whether vaginal or anal contact, can introduce bacteria. If you engage in anal contact followed by vaginal contact, the risk increases dramatically. The bacteria from the anal area, particularly E. coli, are the most common culprits in urinary tract infections. I also want to address the women who tell me, "But Dr. Williams, I don't feel like I need to urinate after sex." This is completely normal and common. Sexual arousal and physical activity can actually suppress the sensation of needing to urinate. Your body is focused on other sensations and responses. But just because you don't feel the urge doesn't mean your bladder is empty or that you shouldn't try. The beauty of this preventive measure is its simplicity and effectiveness. It doesn't require expensive products, special equipment, or complicated routines. It's free, natural, and incredibly powerful in protecting your intimate health. But I want you to understand that this isn't just about UTIs. When bacteria remain in the urogenital area after intimacy, they can also contribute to bacterial vaginosis, yeast infections, and other intimate health issues. The post-sex urination habit is like a foundation for your overall intimate wellness routine. Let me paint a picture of what happens when women implement this simple practice. Last year, I worked with Rebecca, a 29-year-old attorney from Seattle who had been suffering from monthly UTIs for over a year. After implementing the post-sex urination routine along with a few other hygiene adjustments we'll discuss in Chapter 2, she went 8 months without a single infection. Her quality of life improved dramatically, her confidence returned, and she saved hundreds of dollars in medical costs and missed work days. The most heartbreaking part of my practice is seeing women who've suffered in silence, thinking recurrent infections are just something they have to live with, or worse, feeling ashamed to discuss their intimate health concerns. Ladies, your intimate health is not something to be embarrassed about. It's an essential part of your overall wellness that deserves attention and care. Now that you understand why post-sex urination is so crucial, let's dive into exactly how to implement this practice and what else you can do to maintain optimal intimate health. I want to give you a comprehensive action plan that's both practical and scientifically sound. First, let's talk timing and technique. The ideal window for post-sex urination is within 30 minutes after intercourse, but sooner is always better. I recommend making it part of your immediate post-intimacy routine. Think of it as non-negotiable as brushing your teeth before bed. Here's a step-by-step approach that I share with my patients. Immediately after sexual activity, give yourself a moment to transition, then head to the bathroom. Don't worry if you don't feel a strong urge to urinate. Try anyway. Sit on the toilet in a relaxed position, lean slightly forward, and give yourself time. Sometimes it takes a minute or two for your body to respond, especially if you're still experiencing post-intimacy sensations. If you're having trouble initiating urination, try running water from the faucet. The sound can help trigger your body's natural response. You can also try gentle pressure on your lower abdomen or rock slightly back and forth. The goal is to empty your bladder as completely as possible. But what if you genuinely cannot urinate? Don't panic. This happens sometimes, particularly if you're dehydrated or if your bladder was already empty. In this case, try drinking a glass of water and attempt again in 15-20 minutes. The key is making the effort and establishing the habit. Now, let's address hydration, a crucial component that many women overlook. Staying properly hydrated throughout the day ensures that you'll have adequate urine production for that important post-sex flush. I recommend drinking at least 8 glasses of water daily, but increase this amount if you're active, live in a hot climate, or consume caffeine or alcohol, which can be dehydrating. Here's something important that I need to address: the difference between urination and douching. Some women mistakenly think that douching or using feminine washes internally after sex provides the same protective benefit. This is not only incorrect, but can actually be harmful. Douching disrupts your vagina's natural pH balance and healthy bacteria, potentially making you more susceptible to infections, not less. Let me share the story of Amanda, a 26-year-old graphic designer from Austin, who came to me after months of recurring yeast infections. She had been douching with commercial products after every sexual encounter, thinking she was being extra clean and protective. Once we eliminated the douching and focused on simple urination and gentle external cleaning with water, her infections stopped completely within 2 months. Speaking of cleaning, let's discuss the proper post-intimacy hygiene routine. After urinating, you can gently cleanse the external genital area with warm water and a mild, unscented soap if desired. Always wipe from front to back to avoid introducing bacteria from the anal area to the urethral opening. Avoid harsh soaps, perfumed products, or aggressive scrubbing, which can irritate sensitive tissue and disrupt your natural protective barriers. Now, I want to address some common myths and misconceptions that I hear regularly in my practice. Myth number 1. Urinating after sex will wash away sperm and affect conception. This is completely false. Sperm travel through the cervix into the uterus within minutes of ejaculation. Urinating, which empties the bladder through the urethra, has no impact on sperm that have already entered the reproductive tract. Myth number 2. Only women who are prone to UTIs need to urinate after sex. Wrong again. Every woman benefits from this practice, regardless of their infection history. Prevention is always better than treatment, and why wait until you develop a problem to start protecting yourself? Myth number 3. If I don't have symptoms, I don't need to worry about bacteria. Ladies, bacteria can be present without causing immediate symptoms. Some women carry bacteria that don't cause infections until their immune system is compromised, or other factors create the right conditions for bacterial overgrowth. Let's talk about when you should seek medical attention. If you experience burning during urination, frequent urination with only small amounts of urine, cloudy or strong-smelling urine, pelvic pain, or fever, these could be signs of a UTI requiring medical treatment. Don't try to tough it out. Untreated UTIs can lead to serious kidney infections. I also want to address the women who are thinking, Dr. Williams, I've been sexually active for years without following this routine and I've been fine. That's wonderful, and I'm genuinely happy for you. However, our bodies change over time. Hormonal fluctuations, stress levels, immune system changes, and even different sexual partners can affect our susceptibility to infections. Think of post-sex urination as an insurance policy for your intimate health. For my patients who experience recurrent UTIs despite following proper hygiene practices, we sometimes explore additional factors like hormonal imbalances, anatomical considerations, or underlying health conditions. The post-sex urination routine is foundational, but it's part of a comprehensive approach to intimate wellness. I want to emphasize that sexual intimacy should be enjoyable and worry-free. By implementing these simple practices, you're not adding burden to your intimate life. You're protecting it. You're ensuring that your sexual health remains positive and that infections don't interfere with your relationships or quality of life. Finally, let's talk about communication with your partner. A supportive partner will understand and respect your need to use the bathroom after intimacy. This is about your health, not a reflection on them or your experience together. In fact, many of my patients report that when they explained the health reasons behind this routine, their partners became advocates for the practice. Ladies, we've covered so much important ground today, and I hope you're feeling empowered with this knowledge. Remember, the simple act of urinating within 30 minutes after sexual intimacy can be one of your most powerful tools in preventing urinary tract infections and maintaining optimal intimate health. The key takeaways I want you to remember are: make post-sex urination a non-negotiable habit, stay properly hydrated throughout the day, avoid harsh chemicals and douching, and never hesitate to seek medical attention if you experience symptoms of infection. Your intimate health matters, and you deserve to feel confident and comfortable in your own body. If this video has helped you today, please show your support by subscribing to VitalHer, hitting that notification bell, and sharing this information with other women in your life. Together, we can break the silence around women's health and empower each other with knowledge. I genuinely appreciate you taking the time to prioritize your health today. Remember, small changes can lead to significant improvements in your quality of life. Until next time, take care of yourselves, and I'll see you in the next video where we'll continue our journey toward optimal women's health. Stay healthy, stay informed, and stay empowered.